ATTD on Unlock presents Diabetes Health Hub Startup Stories, supported by Novo Nordisk. With Dr. Viral Shah, founder of Diabetes Driving Pal. What inspired you to develop Diabetes Driving Pal? And what challenges do people with diabetes face when driving?
Yeah. So as a provider, that I generally do only diabetes and mostly type 1 diabetes, that you see and you hear the stories from people with diabetes that how dangerous to have low blood sugars in a different situation that includes the driving. And also my co-founder Hal Joseph is living with type 1 diabetes for 60 plus years, and he was also a provider that I worked with. And so a lot of discussion that how can we solve that problem. And I think the lot of problem that the people are facing, they are the ones who are going to tell you the solution. So we started doing some research in the area about what's the prevalence of hypoglycemia, which is low blood sugars while driving in people with type 1 diabetes. And we learned a lot. We surveyed 400 plus people, and we found out that the nearly 75% of people living with type 1 diabetes do experience at least the one low blood sugar event in a month when they are driving. And 26%, 23 to 26% people had either accident or near miss events. That's a lot. One accident can cost you anywhere between $1,200 to $1.8 million, depending on the severity of that accident. And not only that part, the people who are driving on the road are, along with that person, are also at the risk, right? So we, based on our survey, based on the people that have described the problem, we came up with a solution that now we call it a Diabetes Driving Pal. It's a mobile app, and what it does, it's pretty simple solution. It takes the glucose data from a continuous glucose monitor, displays on your car dashboard using CarPlay or Android Play. We don't want you to pick up your phone while you're driving. We want to be safe. And then depending on your blood sugar level and how fast you are dropping, it can give you a different recommendations, and it's all voice based so that you don't have to type anything. So for example, if your blood sugar is now dropping below 70 milligram per deciliter, which is not good while you're driving, then automatically it will pop up the Google map and say, hey, there is a nearby Starbucks 2 minutes away. Do you mind stopping there? And you say yes, and it will take you to that Starbucks so that you don't have to think, you don't have to put any address, you don't have to hold the phone. And if it's again a critically low blood sugars, it will automatically call your friend, family, spouse and say, I'm going to make sure you are safe, right? So we built a lot of features that can help people with diabetes to be safe on the road.
How does Diabetes Driving Pal help users prevent and manage hypoglycemia behind the wheel?
Yeah, so Diabetes Driving Pal app is actually a guidance, not kind of a recommendation. So we want to make sure that we are guiding people that, hey, you have a low blood sugar, and it's a voice-based alert and guidance, and telling them that, hey, making sure that your blood sugar is low, eat some food, have a fast-acting carbohydrates in a place, and we hope that the people will do that part. Because ultimately in any solution, it's some kind of a guidance that the people needs to follow. But we did some focus studies using the Wireframe app, and we have learned that people like that idea. People really want you to make sure that you are telling me and guiding me that part. So I'm hoping that that will translate into the real world. And I think those kind of a simple guidance while they're driving would help people to avoid low blood sugars and potentially those mishaps that we don't want to see.
What role do digital health solutions play in improving safety and independence for people with diabetes?
So the Diabetes Driving Pal, I think our principle is to make sure that people with diabetes are safe while they're driving. And as I mentioned earlier, that this kind of a simple nudge, voice-based solution guidance would help people to number one, avoid low blood sugars. Number two, in case if that low blood sugars happen, is to stop the vehicle at safe place and treat before they drive back, or probably having some kind of a supervision while they're driving with the critical low blood sugars, or probably somebody else is guiding them. And so we hope that this solution will help people to be safe, to live longer, and make other people on the road safe as well.
Looking ahead, how do you see technology further shaping diabetes management and driving safety?
Yeah, so overall, the diabetes technology is now becoming a gold standard way of managing particularly diabetes on insulin therapy, whether it's type 1 diabetes or type 2 diabetes on insulin therapy. And I think till we get a cure, the technology is going to be the key solution. And what we're gonna see, like for example, our app, the Diabetes Driving Pal, is going to be some kind of a supplement solutions around those technology using the data to make sure that the people are safe in different situations, and one of that includes the driving, right? So I feel like that the diabetes technology is the key to manage diabetes, to be safe with diabetes, and to improve the longevity without any complications.
Thank you so much for watching. Discover more stories, insights, and resources at the ATTD Education Portal. See you soon.